Hello, everyone. Welcome to the third edition of the EUSEM special episodes of HitCast, the official podcast of the Croatian Society of Emergency Medicine. Today, I am greatly honored to have as a guest Dr. Effie Polyzogopoulou, who is the chair of the EUSEM Ultrasound Section and also an excellent educator, a great emergency clinician. Hello.
Thank you for the invitation. Thank you. It's an honor.
Thank you for joining us on the show. Quick question to start off, an easy question. Who are you and what do you do?
Thank you. I'm associate professor of emergency medicine. I'm based and I'm working in Athens. I'm working in the biggest and the first university emergency department in the whole country. And we are also one of the first training centers for emergency medicine in Greece because it's a brand new super specialty so far.
That's so great to hear. So many titles, so much work to do, I guess. And one of the jobs that our guest has done, and that's great work, is the new ultrasound curriculum, which we are going to speak today about in lots of detail. So let's start with another simple yet provocative question. Why ultrasound? So why has ultrasound become almost synonymous with emergency medicine today? How has it happened? And why, in your opinion, is it one of our best friends and most reliable tools in 2025?
I can say this from my position. I was practicing medicine long before the integration of ultrasound in our everyday practice. And I can say I cannot imagine how I was doing medicine before ultrasound. Uh, yeah, we know already that it's the new stethoscope, but it's more than this. We can take fast decisions, improves our diagnostic procedure approach of the patient. And what we need in emergency department, we need an answer for critical questions, and we need it now. We need it yesterday. And this is the only, not the only, one of the most important tools we have. That's why, and every day we discover and we incorporate new applications, and we are making our lives easier as physicians, and also the satisfaction of the patients. This is one of the most important aspects, that they are very happy because we are going to the patient. This is the modern approach, not the patient to go to the radiology department. It's a completely different what they are doing compared to us. We are not competitive to each other. It's a different thing what they perform, the official scanning. We are doing clinical ultrasound.
That's a great answer. And regarding Europe, currently, in your opinion, you have lots of contacts with lots of people in the European emergency medicine sphere. Do you think, on average, ultrasound is being done a lot, or maybe there is still room for improvement and for implementing integrated ultrasound in many more European places and clinics?
I can speak only for emergency medicine, and yes, I have feedback due to my position and my involvement in EUSEM Ultrasound Section. So I know what's going on, and there is a huge diversity regarding training in ultrasound, the use of ultrasound, the access to training. So what we face, it's diversity in all these aspects in different countries, as the same specialty in emergency medicine is in other countries. Hopefully, there are only a few. Doesn't exist in other. It's only a super specialty. In most of the countries, it's a primary specialty. So. As we have different levels of emergency medicine across countries, the same applies to ultrasound. It's not the same everywhere. That's why we decided that one of the things we need in order to improve the use of emergency ultrasound is to develop a curriculum. And what it was an unmet need for a long time. And now we started working on this almost 2 years ago. It was a big, huge process. And now we are ready with this.
That's so great to hear. And regarding the curriculum, I'm guessing one of the first things when designing curriculum that crossed your mind was some of the barriers to implementation. Can you share some of those with us, and what was your thought process like? What barriers did you identify, and how did you address them during the curriculum writing?
We decided to include all section member countries. So we give the chance to all members to participate and give their input, how they use ultrasound, in which level, which applications they are more familiar, which are underdeveloped in their place. So the result came out from its European work, 22 countries. It's a huge amount. So we saw there and we incorporated at the final document the basic level and the advanced level of applications. So the story and the mindset behind this and the scope of this document, it's not to take it and use it as it is. Every country can adopt it and adapt it according to their needs. So they can use it as they want in order to improve their training and education on ultrasound.
And do you think trainees might benefit from the ultrasound as, let's say, a reference document? Like, let's say, when asking for more procedures, more education, can they put the document out and say, okay, look, this is something the European experts from all around Europe agreed on. And I really think if they agreed on this, it's reasonable. And I need to do this many ultrasounds. So please give me the chance to do them.
Exactly. They can use it as a frame, as a reference document. Exactly. And they can say, I need this, and I can start from this. And also, it's very useful for the course directors, for the trainers, not only for the trainees. So to know where to start, where they can go, and adapt it and adopt, as I said before, adopt it and adapt it.
Absolutely. And regarding, let's say, certification and such, we of course have the EB in Part B, which also, among other things, tests the ultrasound. Is the ultrasound curriculum and its parts, both theoretical and practical, going to be represented in future board exams? Is there plans?
It's already ultrasound. It's already in the ETR, the European Training Requirements document. So this can be an additional document. There is no separate certification. We will see if there is a need. We will explore this need. But definitely, every country can incorporate in their national exams. I don't know how each country defines the exit exam. They can use it as they want. So it's not strict. It's not like you have to do it. Take whatever you want from this document. It's there for you, and that's the point of this.
Absolutely. That's so nice. And regarding, let's say, the document, would you say that upon completion of all the requirements listed in the curriculum, one can actually call themselves objectively competent in emergency ultrasound for all standards?
It's a different issue. It depends. Not that it's not just a checklist. I have done this and this and this. It's a continuous process, continuous improvement. You cannot just rely and say, I have done this, I have completed. And it involves many training methods. So it's more than just a curriculum. This is the basis.
Yes. Well, let's go just a step above the curriculum. So, while designing the curriculum, did you also have in mind some other non-technical aspects like integrating the findings into clinical decisions, critical thinking about the tests, the, let's say, availability and the appropriateness of choosing a specific scanning method and area for surgery indication and so on?
The purpose of the present document was not to go into the details, but definitely we have included some common clinical scenarios. So to show out that you need not just to do the application, but incorporate it in your case, in the clinical context. That's so we have already incorporated scenarios like trauma, like cardiac arrest, like shock, like fever.
Yeah. So I have a question regarding the, let's say, age gap in current ultrasound education. As I see from, let's say, some of the examples close to me, there are two groups in need of an ultrasound education. There are the trainees like me who are very young people, but there's also the senior staff who never had the chance or maybe never had access to ultrasound before, and now they do. They want to learn. So is the learning part for the two of them the same? Is it similar, or are there some big differences? And can the curriculum serve both of them equally?
Of course, there are differences. Uh, Again, the curriculum is there for everyone, but the training, the learning curves are different. It depends where are you starting from, and what you need at the end to do is to have the as a reference, as we said before, this document as a reference document, and then each one of the how can I say, the old generation or the consultants, whatever, they can use it and take whatever they want and what it's needed in their everyday practice. There is no obligation. You have to do this. This is not a concept. What you need and what you can do in your environment.
Absolutely. And regarding the curriculum, is there any plan to make some official courses based on the curriculum, like the basic one, the advanced one, and so on, maybe for specific indications?
Now the modern approach is not to say for the courses and what we do in our courses, in USEM courses, we don't use any more basic level course or advanced course. We prefer to organize the courses, and Senat Tabakovic is now organizing the courses in USEM with modules. So everyone, and this is the current approach, according to the participants' need, you can take the module which you are not trained enough, you need more training, you need it more in your everyday practice. That's the modern way we provide courses. So it's not the old method with the basic and the advanced. And it's very successful even for the second year. So everyone can cover their own gaps.
That's so great to hear. We're going towards personalized learning, which
Exactly.
is the future. And regarding the future, you've probably seen and probably work with machines equipped with artificial intelligence
That's
that
true.
help us with scans, help us find our way, maybe countings for us, and so on. How do you see AI affecting ultrasound in the next 5 to 10 years? Is it possible that we're just going to put the probe on and the computer is going to do the rest, or do you think the human factor is there to stay and can't be raised ever from the ultrasound examination?
In order to provide and do good medicine, a human has to be there. Of course, machine cannot replace. We can see, according to my opinion, AI and all these new tools as complementary tools in order to improve our technical skills, in order to how can I be the safety net for those who are not adequately trained, but not a replacement, as an add-on tools, I will say.
Excellent. And regarding the ultrasound in emergency medicine as, let's say, an essential tool that we've talked so much about, what's your favorite indication? What's your favorite way to use ultrasound in your daily practice?
Um, Even though we don't need full protocols, I think the most challenging cases are the undifferentiated cases, and we have plenty of them, like shock, like chest pain, dyspnea. All these are, the patients come to us in the emergency department with symptoms, not with diagnosis. And most of them are, they have general symptoms, so they are undifferentiating. And this is so good to narrow your diagnosis by using ultrasound. rule out or rule in diagnosis. This is my favorite and most challenging part.
How long does your average ultrasound examination last? Do you like split it from the physical exam, or do you integrate it and do it like you're auscultating the lungs or anything else while talking to the patient?
Well, it depends of the setting you are working. If you are alone, of course, you're gonna do your ABCD approach and move on with ultrasound. In case you are a team, you have your a consultant, more than one, the residents, the nurses, a whole team. You can do it then at the same time, simultaneously. So someone is doing the ABCD, let's say for a trauma case, and someone else is performing ultrasound, and they're gathering the data, the information, in order to proceed with the diagnostic management. And so it depends how many people are involved in the management of the case. Sometimes you only need to start with ultrasound. In other cases, we will not abandon physical examination. But in some cases, yes, if you are well trained and it's in your mentality and how you practice medicine, yes, you can start with ultrasound, but always with question in before holding the probe and start ultrasound. You need to have a question to answer, not just scanning all around without anything in your mind. So good history and let's say the basic physical examination are still essential.
Thank you. That's such a great message, and might I say, a great closer for our conversation. So, before we go, do you have anything to say to our learners who are so passionate about ultrasound and hardworking and scanning patients as we speak? What's your message to them?
The message is for emergency physicians. This is the recent past, it's the present, and definitely it's the future to practice good medicine, good emergency medicine with the incorporation of ultrasound.
Thank you very much and enjoy the conference.
Thank you very much. Thank you.